Hello viewers, today we have with us Dr. Rituparna Ghosh, who is consultant psychologist at Apollo Hospitals, Navi, Mumbai. Welcome doctor to our live session. Doctor, our today's topic is, can menopause cause anxiety, depression or panic attack? Doctor, we would like to know your thoughts on today's topic.
Hello everyone. Yes, so starting with a little bit of introduction before we go into the details of the topic and delve deep into it. Menopause is something that every woman faces, and it's a part of everybody's life, of every female's lives. But many a times we have seen with majority of the women, they suffer from a lot of mental distress and trauma post-menopause. So this is a very, very important and pertinent topic that we are going to discuss today. And I would be answering few questions pertaining to how mental health gets adversely affected in many women and how we need to work on this to keep ourselves positive post this condition happens or post-menopause.
Doctor, my first question to you is it normal to feel anxious as menopause sets in?
Yes, it is. Most of the women do feel anxious and stressed post-menopause. Now, I would say there are two main reasons related to this, the etiology. The first thing is with menopause, there's a level of change in the reproductive hormones, and that itself leads to a generalized stress and anxiety. At the same time, if you see psychologically, many women cannot accept the fact that I won't be able to bear a child anymore. There is a perception of the feeling that my symbol of femininity is going away. And because of that, it happens many a times women go through this tremendous mental distress. Now, if the level of anxiety and stress is handled well or dealt with in few days or few months, then it's fine. But if it starts interfering with your day-to-day life cycle, then of course, women need help to work on this concern.
Doctor, does having panic attacks mean a person has panic disorder?
This is a very, very good question. And of course, I feel whatever I answer you right now would clear a lot of doubts related to the labeling we do nowadays with people. So panic attack is something that happens which comes or is coupled with palpitations, shortness of breath, sweating, and a lot of fear and worry. And that is mostly associated with some sort of environmental trigger or stressors that happen in our external environment. Because of that, we get these panic attacks. And once these environmental triggers or stress factors go away, the attack subsides. Panic attacks may happen once or twice in your life, but what is the demarcation between a panic attack and a panic disorder is something we all need to understand. If a panic attack keeps on happening persistently, anytime, and maybe at times wherein there is no environmental trigger, no cause, but still you are having a panic attack, or you are always afraid that you may have another attack. So if this goes on in a much more higher frequency and it's quite consistent, then it may lead to a panic disorder. And at the same time, I would say panic attack is not a disorder. It is a symptom of any other mental distress or disorder like a phobia or something like that. But yes, if it goes on happening again and again in a quite consistent and frequent manner, then it may lead to a panic disorder, and therein you need help.
Doctor, is there any link between menopause and depression?
Yes, there can be a link between menopause and depression. Now, as I discussed just now, that menopause comes with a lot of comorbid mental distress or symptoms like anxiety, stress, low mood, dysthymia. But if you're able to manage it in a couple of weeks or a year or month, then it's fine. But if you're unable to manage it and it is actually interfering with your day-to-day schedule, you are not getting pleasure in life, you are feeling those, reactions that are, you are unable to seek pleasure in your day-to-day activities, you are feeling apathy towards doing any activity, you are losing out on spending time with your family members, you're not feeling happy, you're always sad, then it may lead to some sort of depressive features, and that needs help. So make sure that you have to be very careful as a woman post-menopause, that if something that is bothering you and that's lingering for a long, long time, it's affecting, rather I would say it's adversely affecting your mental peace, then of course you need to be careful. You need to share with your near and dear ones, and if needed, you need to seek professional help for that.
Doctor, my next question is, how can a woman know when to seek help for emotional problems during menopause?
Okay, so this is again a very good question related to spreading awareness post-menopause. As I said, in women, many a times it becomes difficult to accept the fact that I'm going through a menopause and certain things are changing in my body. So because of that, a general feeling of anxiety and stress will be there. So as a woman, if you have a generalized feeling of anxiety or distress or low mood, accept it. Don't deny it. Accept the fact. It doesn't make you abnormal, or you may not feel embarrassed about it. Accept it and work on your lifestyle management. Try to share the concerns with your near and dear ones. Work on your lifestyle regime. Those things are important. But if you feel that this distress is not letting you sleep, it's disrupting your sleeping and eating habits, it's not letting you be at peace with yourself, you're unable to seek pleasure in life, and it is somewhere intervening with your day-to-day lifestyle, then of course, that is the time wherein you need help. Now you have to be very careful about few things. Needing help means it can be both ways. Now suppose something is there that is getting too much botheration for you, then at times, of course, psychotherapy works. At the same time, if your anxiety or depressive levels are very high, you need medication along with supportive psychotherapy.
Doctor, can hormone therapy ease emotional problems during menopause?
Yes, to an extent, hormone therapy can reduce the emotional reactions that happen or that comes with menopause. But I would say that is not enough, because what happens with hormone therapy, as we all know, with menopause, the level of hormones, especially estrogen, goes down. So hormone therapy really works, and it to an extent balances helps us to acquire emotional stability. But at the same time, still if you are feeling low, you are feeling upset, you need to undergo some psychotherapy sessions along with medicines if needed. And at the same time, a lot of modification, I would emphasize this again and again, a lot of modification and changes in your lifestyle management.
Doctor, my next question is, what can a woman do to cope with emotional concerns during this phase of her life?
This question I would like to answer in a little bit of detail. First of all, once a woman goes through the phase of menopause, the first step towards working on mental well-being is to accept the fact that I am having a menopause, and that's a very normal phase that every woman goes through. The moment you accept this fact, you are already halfway towards working on your mental well-being. Along with that, what is important is a lot of modifications in your lifestyle. Try exercising, doing yoga, going for jogging, walks. Eat healthy. Introduce a lot of fruits, vegetables, nuts in your diet. Reduce on carbs and sugar. Sleep well. Very, very important. Hydrate yourself. Have a proper sleep. These things are very important to work on your lifestyle management, especially when a woman is going through menopause. And at the same time, your social, skills need to be enhanced. Share with friends. Meet people. Enjoy in a group, talk out your problems. At the same time, inculcate a lot of hobbies, because as we all know, there's a lot of pent-up negativity that keeps on piling up when a woman goes through menopause. In many cases, we have seen many clients, they have this fear of being rejected by their partners, their family, because they feel I am incomplete now because I can't bear a child. I'm losing on my femininity. You need to work on this thought process as well. And for that, you need to inculcate a lot of hobbies so that this, negativity that gets on piling up inside our minds gets channelized through a very good positive outlet. At the same time, I would say that along with all the lifestyle changes, if still you are facing difficulty in handling your emotional disturbances, please do contact a psychiatrist for medication and undergo psychotherapy from a psychologist. Because psychotherapy, a part of psychotherapy is cognitive behavior therapy, wherein, we need to work on the thought process to challenge those negative thoughts and to overpower them with substitute positive thoughts. Because that is very important for a woman to work upon, to come out of this continuous circle of feeling negative post a menopause. So these are certain things which are very important, and yes, do share with others. Don't feel embarrassed that why am I the only woman who is having these emotional disturbances post menopause? No, it's not. Every woman goes through some sort of ups and downs in their mental well-being post a menopause. But you need to talk, you need to share, and you need to express and verbalize your feelings right now, because the more you externalize your stress, the more you work upon your well-being. On the contrary, if you just keep on internalizing your stress, not discussing it with others, not coming up and sharing the fact that I am feeling very low post-menopause, then it will actually aggravate these emotional disturbances. So break that chain, focus on your well-being and talk it out.
Doctor, my last question to you is, are problems with memory and concentration a normal part of menopause?
To an extent, yes. In many women, it has been observed that cognitive domains, especially memory, concentration, does get adversely affected to an extent because of the lowering down of the estrogen hormone. But there's nothing to worry about that. If you are introducing a lot of positive changes in your lifestyle, if you're working on your well-being, automatically these concerns will go away with time. One thing I would like to emphasize here that we have seen in many women, the emotional disturbances post-menopause can go on for years, more than 5, 7, 7.5 years. But if you can cope up well and if you can accept the concern that, okay, so this particular thing is actually making me forget certain things, it's affecting my memory, it's affecting my well-being, I need to work on it, I need to seek help, then automatically these concerns will go with time and you will feel much better. I would like to emphasize here one very, very important thing to work on your well-being, especially post-menopause, is that instead of continuously emphasizing on the fact that my femininity is going away, I cannot bear a child, and all those, negative labels that we keep on telling ourselves, most of the women do. Rather, if we can reframe those statements and tell ourselves that let's channelize this negative energy by doing some hobbies that we want to do, and let us enjoy the freedom that we will be going through right now. That is very, very important. So, globally accepting the fact, wholeheartedly accepting the fact that menopause is a normal process that every woman goes through in their life. Accept it. And if you are having concerns, accept that too. If it's not hampering your daily schedule and with all the coping mechanisms you are adopting, you are able to deal with it, well and good. But if it's hampering and your daily lifestyle and it's, actually intervening your mental well-being for a longer duration, you need help. Nothing to feel embarrassed about it. Nothing to feel upset about it. Come and seek help. Because as women, we all know that this is a normal phase of our life that we all will go through at one point of our times. And the more we accept it wholeheartedly, the more it's easy for us to deal with it and stay mentally positive. Because if we are aware of so many things about our physical health, suppose if we are having a stomach ache or a headache, we are so much aware to call up the physician and describe our concerns and get ourselves treated, then why not about our mental concerns post a menopause? It's a normal thing to happen. With some women, it happens to a mild degree. With some, it happens to a moderate to a severe degree. But everything can be treated. Accept the fact, seek professional help if needed, break the chain, let those, stereotypic ideas and prejudices go away from your mind. Just speak up and get yourselves treated so that post-menopause also you can lead a same healthy and happy life and be a productive and positive woman that you were before menopause as well.
Thank you, doctor, for answering all our questions related to menopause and whether it can cause anxiety, depression, or panic attacks.
And before I end, I would just like to emphasize on one thing. Your mental health is very, very important. Do focus on that. As much as we emphasize on our physical health, we need to focus on our mental well-being as well. So the main thing that we need to discuss, it's not only about menopause, it's about our whole mental well-being, is that break those chains of prejudice. This I always say in all my talks and to all my clients that, no health is possible without mental health, because our mind and body, it works together for the totality of our well-being. And as a woman, I would say, accept yourself wholeheartedly. It's a part of our life. Remember the days when we first have our menstruation, that's called menarche. We do feel uncomfortable. At the same time, when we have our menopause, we will feel uncomfortable. But that's a part of our lives. We need to accept it, and we need to move forward with productivity, positivity, and lead the same healthy life that we were leading earlier as well. Thank you so much.